Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 311,109 confirmed cases of COVID-19 in Canada and 98,162 cases in Ontario. Chatham-Kent has 469 cases, and Sarnia-Lambton has reported 392 cases. Michigan now has 277,806 cases, with 17,941 cases being in Detroit. Today, we are reporting 27 new cases of COVID-19 in Windsor and Essex County. 9 are close contacts of confirmed cases, 5 are community acquired, and 13 are still being investigated. We have had 3,165 cases since March. 2,888 cases are now resolved, and 200 cases are active and being followed by our health unit. 11 people are currently in the hospital and 2 people are in ICU. Our community has lost 77 people to COVID. 54 deaths have occurred among residents in long-term care and retirement homes. There are currently 3 long-term care and retirement homes experiencing a COVID outbreak. There is 1 outbreak in the agri-farm sector and 1 community outbreak in a post-secondary student residence. Today, we are reporting a 2nd outbreak in a Windsor elementary school, W.J. Langlois. This outbreak is contained to 1 class and not the whole school. We are working closely with both schools and school boards. For students and staff of Bagley School, Windsor Regional Hospital has arranged dedicated testing at the Met campus at their emergency department parking lot. No appointment is necessary and staff and students can walk in. Testing at Met campus is available today and tomorrow from noon until 7 p.m. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit the number of contacts you have. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering if you cannot maintain a 2-meter distance from others. Avoid touching your eyes, nose, and mouth with unwashed hands. And cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Download the COVID Exposure Alert app at canada.ca. For residents of Windsor and Essex County, testing is also available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 2 testing and assessment centers, Windsor Regional Hospital, Olette Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. As Teresa mentioned, we are declaring another outbreak at one of our local schools where we have evidence of transmission in the classroom settings. Based on our investigation, this outbreak is limited to 1 classroom only at this time. The class cohort is already dismissed and currently self-isolating. Now that we have established transmission in that cohort based on the classroom exposure, we are now strongly recommending everyone from that cohort to get tested. Our team is working closely with the school and the school board to ensure that all the appropriate measures, including direct notification to family, is happening, as well as identifying any other high-risk close contacts as a result of this investigation. The rising number of cases in the community and the spillover effect of these cases into our school is a reminder for all of us to be vigilant for COVID-19. It is now more than ever important to continue to monitor your own symptom and stay home if you are sick. And as always, assess your child for any symptom daily before sending them to school. I'll now switch topic to another important public health issue. In the light of Bullying Awareness Week, I wanted to take an opportunity to discuss the harmful impact of stigma and bullying that has on all of us and encourage you to share kindness and empathy during this extraordinary and challenging time in our history. Since the beginning of the pandemic, we have seen the results and impact of COVID-19 related stigma and bullying on individuals and on our community. Stigma often stems from a lack of knowledge, fear, or feeling the need to place blame. Stigma can lead to people hiding symptoms or avoid testing out of fear with what may be said to them or about them because of their diagnosis. Bullying or cyberbullying can be a common outcome from stigma. Recently, instances of cyberbullying have been documented among all age groups and across various social media platforms, and is particularly concerning among youth. Cyberbullying can include sending mean or threatening emails, messages, images, or text. These messages may be sent to the individual themselves or circulate among peers. Related to COVID-19, there can be online gossip about potential cases, threats around disclosing information about close contacts, and even threats made to victim for being ill. Cyberbullying can be inescapable, as it can occur at all hours of the day through a variety of social media platforms. Online bullying can have serious impacts. People who are cyberbullied often feel an intense sense of isolation, fear, loneliness, and despair, feelings which may be heightened due to the pandemic. Cyberbullying can significantly affect individuals' mental health, which in the most severe case have led to acts of self-harm and even suicide. Some people, and especially youth, may not know the potential consequences of online bullying. Depending on the content of the message or image, criminal and legal action can be taken. For example, threats or violence against another person can be categorized as assault or criminal harassment. I was bullied many times even before the pandemic, but now it has increased and forced me to report these bullying to the appropriate law enforcement agencies at times. Just remember, it is not okay to bully anyone, and if you feel that you are being bullied, reach out for support, especially if it's threatening in nature. Having an opinion about something is very different than challenging others on their opinion. It is okay to stick to what you believe, even if it's not accurate, but you cannot intimidate others based on your personal belief. To prevent, reduce stigma and bullying, stick to the facts about COVID and follow credible sources for information. Correct misinformation and speak out against stigmatizing behavior. Use positive and supportive language. Most importantly, respect personal privacy. A person's health information should stay personal. Talk to your children about stigma, bullying, and the consequences. Remember to practice kindness. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Today we'll start with AMA 100.
Teresa, was the outbreak decided this morning? I'm just looking on the board's website, and under closure status, it still says open. So was this just made recently?
So we talked about this late last night, and it will be posted on our website and likely the school's website today. Our media release is going out at 10 o'clock today. It is contained to one classroom, not the whole school. So the outbreak is contained to one specific class cohort, not the entire school.
So just for clarification, does that mean the whole school shut down or just that one class?
Just the one classroom. The school remains open for everyone else. It's just the students and staff from that class cohort, that classroom.
And sorry, same kind of question I asked yesterday, but obviously they have to isolate for 14 days, and depending on the test, that's when Dr. Ahmed will make the call when they can come back in the classroom? Exactly.
Yes, these students had already been previously released based on a case, so they were already at home self-isolating. So there's been further cases from that cohort, and as such it is meets the definition of an outbreak for that classroom.
Do you know the date they've been self-isolating since?
I don't, because we have a lot of schools that we're dealing with. I don't We'll have to find that out, but I'm not quite sure.
Okay, thank you.
Any questions from CBC?
Yeah, sorry, I think I missed the name of the school outbreak. Was it Westgate that you said?
No, so there's an outbreak of the whole school at Bagley, and then the newest one today being reported is in the classroom, and it's at WJ Langlois.
Okay, thank you. And do we know how many student staff are isolating as a result of that class being sent home?
Approximately 20 people are involved in this group.
Okay, and there's 2 positive cases.
2 cases, yes. At least 2 cases, yeah, so at least 2 cases. We're still investigating, but the outbreak was called based on 2 cases in the same classroom.
Okay. And that Agri Farm outbreak that's in Leamington, based on our calculations here, it's about 60 cases. Is that business still operating, or has it been shut down or stopped working at this time?
Well, the business is experiencing a lot of challenges. They have very few workers on site right now doing the work, but this weekend, some of the people that have been isolating will be returned back to the farm if they don't have any symptoms. So today we'll be working on some people possibly returning as early as today, and another group on Sunday. So they are slowly getting their workers back, but I think this outbreak has definitely impacted their ability to operate.
Okay, but they never closed at any point?
I don't believe they closed, but I think they've been very challenged to continue in their current, on their current schedule or their operations.
Okay, thank you.
Any questions from Blackburn?
I don't think I've been asked. Thank you.
Okay. Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. I see that Westgate has 2 cases, as does Riverside Secondary School. Are those people siblings? Are you still investigating whether or not those are connected?
So when we do the cases in the schools, they could be siblings. I'm not, I don't know exactly who they are, but if they're not related, or there's not, or if they're a second case, it often is that it's a sibling and that they're both off. But if they're not deemed an outbreak, then those 2 cases aren't, there's no transmission concern in that school at this time, those schools at this time.
Okay, and then separately, Dr. Ahmed, you said that you've had to contact law enforcement because of bullying against you. Can you expand on that at all? Have people been threatening your life?
Well, we've received many threatening letters to the health unit, and also emails, and which is again all understandable. People are frustrated, people are upset, but the message about this bullying awareness, it is common. People are doing that, especially in this time around when everyone is suffering from many of the impacts of COVID. And the message today is what we want to share. It's not okay to bully anyone. And if you feel that you're impacted by it, just feel that you're not alone, because most of these victims of bullying, they do not come out and say anything. But when more and more people are coming out, it challenges the bully about their behavior. So there are, you're not alone. And for the rest of the community, even though whatever you believe in, whether you believe in science, whether you not believe in science, whether you believe in COVID and all these measures or not, whether you agree with all the decision that is being made, that's okay to have your own belief, but that belief doesn't allow you to challenge anyone. So I think that's the key message here, is show some kindness, respect everyone's belief, and then try to respect everyone's privacy. And that is really important as we still manage through this pandemic and try to survive through it with all the challenges that we are facing right now.
Okay, thank you.
Any further questions from AM 800?
I guess, Dr. Ahmed, just to that point, even Teresa, how has this impacted, I guess, both of you have families, like you mentioned, I believe you both have children. How has this impacted your family's well-being? Obviously, are they impacted as well?
So I'll start, and I don't know if Teresa wants to add, but definitely, I think, your children also see what kind of behavior that you are presenting and exhibiting, and they model your behavior. Whatever you are showing out to them, they learn that. If you are showing kindness, they will learn kindness. If you're showing a bullying behavior, a bullying pattern, they will learn from that. So I think it is important that we all understand that. My oldest son is 13 years old, and so he understands what's happening, and he is going to the school. So and we have conversation. He gets upset when he reads things or see people making any mean comments about me. He gets upset too. He feels that that they don't have the right to do it. So I teach them. I use that as an opportunity to teach him what people do. It's beyond our control or anyone's control. You cannot control behavior. So that's what we are saying, that it's inescapable, this bullying behavior. So the only thing that we can change the perspective of the society is to learn to be kind. It's to learn to be okay to have your own opinion. That's okay. But your opinion having an opinion do not mean that you can start challenging anyone and everyone about whatever they believe in and try to intimidate them in such a way that they either be quiet, and that's the most common thing that happens when there are these bullying patterns and bullying behavior starts. People start to speak out against it. And if you're looking at whatever is happening in the social media, and again, it's not directed at anyone. So I'll just want to be clear, because I think there are people who have strong opinions on everything. But what happens is when these strong opinionated people start talking and start bullying others, then it just take away all the other rational voices, and then people stop following that, reading that, or even expressing themselves, with the fear of being bullied. If I write something about something, like for example, let's say about vaccine or about mask, and someone starts to come and challenge at me, and then challenge me, personally attacking me in my comments or something, I would say, I would rather not comment at all. And then what happens is then these people start to get their voice louder and louder, and then all the challenging and opposing views are gone. So now we are losing that opportunity for any kind of dialogue or any kind of an understanding. So I think this is important, that as a society, we should understand and recognize where we are heading right now with this type of behavior. Are we modeling that anyone who is a bully, it's an okay to be a bully and then challenge everyone else? Is that the message that we want to teach our children? And what kind of an impact it would have on a long-term basis? So all these questions are very important questions that we need to think as a society, and think about the mental impact and social impact and societal impact that it would have on us, our children, for a long, long time. So please, the message is, be respectful, be kind to everyone.
Dr. Ahmed, one more here, COVID-related, but not COVID-related, I guess. Tomorrow night, there's the candlelight vigil. Obviously, a very sad story in Windsor-Essex after a fatal hit and run. The neighborhood is planning a candlelight vigil. Who knows how many people are going to go out, but are you just asking them, make sure they social distance, wear their mask? Obviously, it's going to be very emotional, very tough evening tomorrow night. But just for those that do go out, what would you tell them?
Well, as much as I think I can sympathize with everyone who are feeling that emotional tragedy at this time. But the public health message, I think we still have to follow. I personally think that there could be other ways to show and express your sympathy, and instead of congregating together. there could be a number of ways, and I think people are being very creative in terms of how they can do that. You can visit, or you can show express your emotion and support in many different forms without the needing to come together in a large group. And if you still plan to go out and you still need to follow that, what are the guidelines and how you can keep yourself safe, keep your family safe, and keep your community safe. Because if you are going out there to express a tragedy, you have to remember, if more and more people contract COVID as a result of you going out, it will itself result in another tragedy. We don't want one tragedy to justify another tragedy. So I think it's really important that we know that, yes, everyone feels everything that's going around them, but find better ways to do that in a safe manner, not putting anyone at risk, including your own family.
Thank you.
Any further questions from CBC?
Yeah, I'm just wondering, Dr. Ahmed, are you satisfied with the enforcement plans that have been laid out by local mayors? They talked about it last evening.
So we did, our team is working with all our municipalities to do more of that enforcement piece. And I think still the message needs to be very clear about what the expectation is and what we are looking for. We don't want anyone to get caught off guard to say that, well, they didn't know, or what was the expectation. And if people are thinking that, well, maybe the first instance I will be provided an opportunity for education. I think we've been doing that for quite a long time now. So we have to really think about, what is our role? Everyone has suffered, like everyone, and I really mean it. Everyone has suffered throughout this pandemic. And there are people who are doing a lot more than anyone else to just keep themselves safe and do their part when they're outside. And then you have people on the opposite spectrum who do not have any regard for anyone else, and they're in violation of many of these rules, many of these public health guidelines for a long period of time. So those are all intentional ones. And then you have someone who doesn't have the time or doesn't feel that it's important for them to do anything. They expect that everyone else should do it, but they don't feel that it's them, that they have the responsibility. And we just want to shift the message to say that no, setting out the clear expectation that it is everyone's responsibility. If you are not aware of what your obligation is, too bad. It's still time to go and look at what the guidelines is, what the regulation says, what the law says, and follow those guidelines. It is our responsibility as individual and as a society. So I really hope that when we are working together, we have those clear expectations outlined and start enforcing it. And again, I know the mayor talks about it's time to educate the bank accounts, which I get it, but again, for me or for anyone else, even from the city, it's not going to make any difference, like in terms of how much enforcement charges that we laid. It's one of those deterrent that we want to use, because I think if people are not getting the message, maybe sometimes that the threat for these fines and charges will help them to comply. We really don't want to get there. We really hope that our enforcement would result in better compliance rather than issuing more tickets and issuing fines.
And have there been any other updates regarding the school outbreak? Any other details about the path or the nature of transmission that happened?
Well, in most of the cases, what we are experiencing in this school setting is the family is impacted by COVID first, and then as a result, one of their child is exposed, and then they attended the school, and as a result of them attending school, there could be possible exposure to others. So that has typically been the pathway in terms of how the spread is happening in the school. And in a couple of instances where we have established any transmission in the school setting, and those are the two instances where we declared the outbreak because of the risk to everyone else. Hoping that if we are following all those screening requirements and keeping a close eye on our children, I think we can do a better job, because these children, their main exposure source is their family. And then if their family is safe, and when they're coming to the school will be safe. And we have to look at what's happening and how our children are behaving in the school too. And I can understand when the school started, there was a lot of focus and enforcement in terms of how parents are looking at their children and ensuring that they are wearing the mask, they are following everything. And now it's been more than 2 months now since the school started. I can personally speak from my experiences as a parent that there are now people, students, parents, they are not doing everything that they should, including some of the staff. I think it's about time that we revisit that. We don't want to sound like a broken record, but this is still a pandemic. It is not over. The case counts will fluctuate up and down all the time. Having a low case count doesn't mean that the risk is gone. The risk still exists, and it takes only few moments to change, a few days to change that risk. 2 weeks ago, we were reporting the case counts in single digit. This week, we're constantly reporting case counts, roughly hovering around 20 cases a day, which is quite a lot for our community. And I think it really puts at a bigger risk of how bad it can be. We have already started to see signs of our acute care system overloading. So I think it's important that, you know, when people are thinking about how it's spreading in the school, it's also thinking how we can prevent it. And that has been our messaging. And the best prevention is making sure that you are screening your child before they're going to school, and then your child is following all those guidelines as they should, and have that conversation, repeat those conversations again and again to keep your own child safe. And also, if your child gets sick, let's say, for example, in however ways, that how they can protect others. The importance of hand washing, the importance of physical distancing, the importance of using a facial cloth mask is also important. So hoping that all this learning will educate our parents much better, and we can prevent more cases in the school system.
Just another quick question here. For siblings of the students that have been sent home because of the school outbreak, if the siblings attend a different school, should they also be staying home from classes?
Okay. So typically what happens is if we have a case in a child that is started as in a child, and then automatically all the siblings of that particular child will become high-risk close contacts. And if they are high-risk close contacts, they will be taken off of the school. And in instances when we have a parent who is a case, and again, same idea, all the children in the family will be considered as high-risk close contacts, and they will have to isolate. But let's say if you have a child or a case in a class, and then that class cohort is dismissed home. And then among those students who are already dismissed, if they have another sibling, they are not dismissed, or they are not going home and self-isolating because they're a contact of a contact.
Unless the case is a student.
Yes, yeah, so it gets a little bit challenging, but generally in most of the time, if the case is a student and all their siblings are to self-isolate.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
Thank you, everyone.
Thank you.